coma and unconscious, and she was brought to the hospital. So by the time she arrived at the hospital, she already lost her vital signs, and so we installed the ECMOs. And so we also performed several times of defibrillations. And after that, she started to gain the heart rhythm back, and she started to move and also gain her conscious. For saving the life is to save the family. And but the lady, she says she just gave birth to babies. So how to benefit the societies? The brand new space with a sterile space, it was a better image. A hybrid operation room was put into formal use since April. Like in Dalin, we also set up the brand new equipments like this hybrid operation rooms. Within 3 months, we were able to perform almost 500 cases, major surgery like acute aortic dissection, coronary artery bypass surgeries, or the dialysis fistula surgeries. We needed very advanced equipments. So within 3 months that we performed almost 500 cases of the major surgeries. And when the patient was brought into the hospital, we were able to perform the diagnosis and the treatments and the surgery in time. And we can shorten the time to save the life. So with this image, you can make the vessel 12 times. And 2 years ago, so we starting to perform the laparoscopies. So with the colorectal cancer treatments, we have a higher survival rate than the other hospital. So with the talents, doctors, and brand new equipments, we can save lots of lives. And the following video is very touching. For the 62 years old patient, he's a patient of the silent hypoxia. He could collapse anytime. And after 19 days of the treatments, he was ready to discharge the next day. But the next day, his discharging runs happened to be his birthday. So before he discharged, the medical team prepared a little cake for him that he can start his brand new life. So it's write down happy birthday on the cake. And on the day he discharged, we brought in the cake and also sing birthday songs to him that we celebrate his to be reborn. And during the treatments, all the medical team was very touching. They encouraged me a lot, and they even bought the little cake for me and took picture with me. I was so grateful about this. With all the sincere blessing from the patients, from the doctors, this is the best gift for him. As a surgical doctor, are you busy? Of course you are. But with the treatment, with our charities, and this doctor is very touching and very talented. So let's welcome our cardiac surgery department, the chief of the cardiac surgery department, Chief Zhang Jianhua. His name is, it means a lot because he's so talented. He's willing to challenge a lot of new techniques. So, but Zhang, I have a question for you. How will you attend this competition, the athlete competitions? So at that time, I was thinking with the habits of the exercise, I used to swim and I run and I ride a bicycle very frequently. So if you combine all three kinds of exercise altogether, it seems like very challenge. So that's why I attend these competitions. I think it might be also a assistant because his job is as a surgeon. Once the operation started, it usually take hours to finish the operation. So the longest surgeries is around probably the surgeries from midnight. If it's an urgent surgery, we will start the operation since 8 o'clock at night until the next day mornings. So you really need a lot of energy to be able to perform the surgery. And I was wondering how come you're also interested in our histories. So personally, myself is very interesting. And besides the medical textbooks, I also have a lot of books about the history to understand more about the people in the past, how they conquer the difficulties. He's a very talented person, and for very touching things is that he just married. He happened to meet the patients, and because he want to raise the fund for the patient's medical expense. So the doctor donated all of the money that they received through their weddings. So in our hospital with the doctor like this, he's not only treating the patient, he is also very touching with a warm heart, with his compassion all combined together. He is really the blessing for our patients. So, like last year when Taiwan was with the epidemic, the 3 degrees alert, a lot of patients cannot fit in Taipei, but in Dalin City, we also had this special room to take care of those COVID-19 patients. So we really that's led the Chief Zhang Jianhua to share his stories. Mr. Zhuyan, the master from about all the Ciji families. Good day, I'm Zhang Jianhua. I really appreciate our host that introduced me in such a good ways. And what I'm trying to share with you is the minimally invasive surgery and a transcatheter aortic valve implantation. What I would like to share with you is the reason that I came to Dalin Ciji. Why would I choose the cardiac surgery departments? Because how the traditional cardiac surgery turn into the minimally invasive surgeries. So a lot of time we see the news, we saw it on the news with like during from the news, the patient during the meeting and they suddenly suffer from the acute heart disease or the stroke. And the family fighting with saturated, so the father suddenly has a heart attack or due to the peripheral arterial occlusion that causes a lower extremity stroke. With all this urgent emergency surgery, and most of them, they were part of the cardio surgery because they're all criticals. So when I was at the medical schools, personally, I like to put it in practice. I just see the effect right away. So at that time, maybe the surgical department is I'm more interested in the surgical departments, and also the other a lot of departments like nowadays the most popular department is the plastic surgery departments, but we are very different compared with the plastic surgery departments. When I was an intern, I was in the I was learning in the hospital, and I saw the patient. She was so pretty, and she walked into the hospital, and she was so worried about that. My eye bag. There's a black shadow in my eye bag, and we really take a very good look about her eyes, and there was a swelling in our under your eyes. It seems like that was caused by the lights because it's the shadows under your eyes. But at that time, this is really not a critical condition. And do you know there's a lot of patients in the emergency room that were waiting to save their lives. So I really have no patience to deal with such a minor problem. That's why I choose to be cardio surgery department's doctors. For as a cardiac surgeon, if I wasn't there and the patient might lose his life. So this is what I can say proudly. Like in the emergency surgery, we classify that in 3 levels. With the A level, that is within 30 minutes, we need to treat the patient within 30 minutes. And usually the cardiac surgery is a critical department. And the gynecologists, if the usually the pregnant ladies, they were having the problems during the deliveries. And that's the time the patient was brought into the hospital, but nobody know how to deal with it. But with the cardiac surgery, it's a very critical emergencies. And what I mentioned earlier is that we started surgeries from midnight to treat the acute aortic dissections. And we were able to complete the aortic artery placement and the thoracic aortic stent placement. Usually, surgery like this is a very difficult surgeries. And after we complete this, the surgery duration is very long. We work from the midnight till the mornings. So after we all work together and we save the patient's lives. So we are all very exhausted. And by the time you walk out of the operation room, you feel there's a light above your head because we just saved a precious lives. So like the pregnant lady who's suffering from the pulmonary embolisms, she actually just gave birth to twins. So when they were get birth, and the mother is still in the hospital, and the mom feels that she couldn't catch up her breath. So at that time, the doctor thinks that something wrong about her. So actually, we performed the CPR on the ambulance, and on the way to Dalin, we already received a call that a pregnant lady, she suffered from the pulmonary embolism. So by the time she brought to the hospital, everybody all stay at the emergency room, and we performed CPR and defibrillation, and finally we were able to save her lives. Like at that time, our surgical departments, that was before the epidemic, and a doctor from China, he witnessed all this rescue process. He was very impressive. And in China, there were also 3 categories in China. So in the past, when he saw this kind of case, like a pulmonary embolisms, almost everybody almost all of the patients, they are not able to lift. So on that day, he witnessed the whole process with our treatments, and he was so impressed that our team saved the whole family's life. So as this critical departments, and for all the staff, we need to stand by 24 hours. So we need a strong teams. So the longest surgeries, like the surgery lasts over 10 hours. This is very common, and it's also not healthy toward the patient, also toward the doctor. It's very difficult missions. So you need a strong teams, and they were able to save the patients, and we will not lose any lives. So in the central Taiwan's, in all these areas, like more than a million populations, we only have 7 hospitals that has the surgical departments, and out of the hospitals, there only with 1 cardio surgeons, and they all have to deal with such a critical conditions. It's a very difficult task. So when the time I come to Dalin, at that time there is only 1 cardio surgeon, and he is very helpless. He said that he is very busy. He really can have more assistance. So after when I when I go to the Darlings, we will take turn to cover the other hospitals, to assist the other hospital. So as my first years of the residence, at that time, they were not able to perform the MRI chest exam. So we need to deliver the patient from this hospital to Darlings. And when the emergency ambulance rides through the Dalin Hospital, that was in the middle of nowhere, and I was very impressed. How come the hospital like this with such a high technologies equipments? And when I was grown up in Taipei, and with more than 8,000 students, and I was living in a city, and I really want to live in a countryside. And Dalin City is actually located in the countryside, and it's in the middle of nowhere, but it can perform such a great surgeries like Taidong, Hualien. They're also, and the hospital is also located in cities. But it's so amazing that Dalin, located in such a suburb area, and they were able to perform such an advanced surgery. So I really appreciate the Master Zheng Yan, who can build such a hospital that we can protect patient here. And in our cardio surgery, we have 5 doctors, the cardio surgeons, and with all the teams work together. If we have to perform the surgery for a long time, we can take turn to cover each other's. Not just one person perform the surgery all by himself with no assistant. So we have a great team that is very important, and we also have a very good equipment. This is the caster rooms, and he set up this caster room that we need to expand the castration rooms, and with all this high-tech facilities. So in this hybrid operation room, we were able to perform the surgery, perform the diagnosis, and to save life within times. So In central Taiwan, actually, Dalin is the first hospital that we can perform the transcatheter aortic valve emplacement, TAVI. So this is actually the most advanced surgeries. And at that time, we had the equipment like this, and we will recruit more cardiac surgeons. At that time, by the time I attended Dalin, there were 2 cardiac surgeons, and later on, the other one left. So we recruit more and more people to join the cardiac surgical departments. So transcasters, artery aortic valve implantations, we don't need to perform the operations. We can do the femoral arteries to perform the transcasters, cardiosurgeries, and we can also place a stent to dilate the narrow arteries of the coronary artery bypass. And without a big incision, we can lower the surgical risk. So while we perform the TAVI surgeries, and usually we're dealing with the urgent critical patients, and the patient usually the traditional operation, they will have a big incisions and they need long time to recoveries, especially for the patients suffer from the aortic stenosis. Usually the patients are very old and they cannot stand the operations, the traditional operations. And because he's suffering from the aortic stenosis and the recovery is very slow, and nobody was able there to give him an operation because he's too old and it's too risky to perform the operations. So to treat this disease is really challenging, and later on his condition is getting more and more severe, and maybe a couple of years later, with the new technologies, the patient will be more willing to receive the surgeries. So with this kind of surgery, usually the insurance won't cover, and with a valve, it costs more than $100 million, and not much patient can afford it. And actually, this operation required to have a hybrid operation room, and all the doctor need to be certified as a TAVI surgeons. So at least, actually, I think that we can apply for the hospital that can train for these techniques. And lots of the medical center, they don't really have such a techniques, and we are actually the local hospitals. So I was encouraged that everybody search for the information all together, and we would like to build up the hybrid operation rooms. And the sponsor, they don't really support us because they think it's not doable. They all worry about whether this was success or not. So we keep putting the efforts. We also create a study groups because it's a very advanced surgery. We combine the surgical departments and the cardiologists and the radiologists. We just combine all departments. Everybody work together, and we work all trends. And in 2016, we successfully performed the first patient with the TAVI surgery, and the patient is over 80 years old, and he said that Even he sit down to take a bath, he feel like it's difficult to breathe, and his family also worried that he cannot. It could be very risky for him to do operations, but through the new advance, that the family agreed him to receive the surgeries, and the patient also qualified for the health insurance coverage. So after the surgery, actually his recovery period is very short. And for the traditional operation, the incision usually very big or is taking time to recoveries. But our surgery just through the femoral artery and the very small incision, and the surgery only take within an hour. And when he was brought into the intensive care units, he can walk, he's conscious, he even can walk after 1 hour. So when he discharged from the hospital, his family is so happy that his mom can breathe normally, and they really very grateful. So this is the very first case that we performed TAVIs. So in 2018, when we first starting this TAVI surgeries, at that time we need to have the specialists from overseas to give us lessons, to train us, and they also give us a list how to become a qualified TAVI surgeries teams. So we are the first hospital amongst the hospital that can perform TAVI independently. And what you see from the screen is a hybrid operation room 2.0 in Dalin. I really appreciate everybody's support that we can have the brand new hybrid operation room. We can perform more exams. So till now, we already complete 16 cases of the TAVI surgeries. We started actually in 2016, but because it costs too much money. But last year, after the health insurance covered the expense, so now we have more cases that need the TAVI surgeries. And health insurance actually have their indication. The patient has to be the high risk patient and with such as aortic stenosis. Not all of the patients they are qualified as a high risk patients that could get the health insurance covers. So for the lower risk patient, we also have to say of something to help them. So we will perform the minimally invasive surgeries. Earlier we talked about the transcasters, and the traditional operation you need bigger incisions, but a minimally invasive surgery we only need the small incisions, and the one is small, so we have a lot of surgical instrument to perform the minimally aortic valve replacements. And the caster is about 0.5 centimeters. Such as this patient, he's 81 years old, he's old, but when he arrived at our hospital, he heard about that we were able to perform this transcaster valve implantations, and the patient is 81 years old, but he actually looks pretty healthy, but he only suffers from the valve problems, but he doesn't have another chronic disease. But he only had this the cardiac valve problems. So I tell the patients, even you're more than 80 years old, but I think you're in a very good health condition. If you like to perform the TAVIs, you're probably not able to pass the insurance coverage because your risk is not high enough. So you need to perform the traditional operation, or you need to cover your own expense to perform the TAVI surgeries. Or maybe we can perform the other minimally invasive surgeries with a small incision that you can recover faster. So he discussed with his family, and maybe this is doable. So we performed this minimally aortic valve implantations, and when it is small, but we were able to fix the valve and to replace a new valve for him. So what we talk about the artery stenosis, what is called a stenosis? The valve is like a doorway to your heart. So when during the heart construction, the door need to open to let the blood flow into your blood. And so the valve need to close when the blood into the flow into the heart. This is what the function of the valves. And the cardiac stenosis, that means the valve is not function very well. So the patients often feel chest tightness or the chest pains. So if the circulation is not working function normally, the patient could collapse within minutes. So the process, so the syndrome start to appears, then we can treat it with the medicine first. But sometimes the medication doesn't work, and in that case, we will need to perform the surgery to replace the valve. So we do the minimally invasive surgery to do valve replacements, and I did not. So the recovery is very fast, and we can also perform the transcatheter mitral valve repairs. And the mitral valve is actually a back door of your heart. During the construction, the front door has to open and the back door has to close. And what happens a lot is what we call the mitral valve disease. Is always the mitral valve that having the problems. And besides the traditional operations, we can also perform the minimally invasive surgery that can repair the mitral valve. And after we fix the mitral valve, the infection is it can last longer and it's more efficiency compared with the TAVIs. And there's another patient, 22 years old, and after he was vaccinated, he felt his heartbeat is very fast. So he came to the hospital to check, and we found out that he has acute mitral valve disease, and in the future, he will suffer from the heart failure. It's on the timing matters. So we discussed with his family that we can perform the minimally invasive surgery. We can also perform the mitral valve repairments. And for the young persons, and to perform the valve repairment, there's a separate types of the valve. The mechanic valves, they can last longer, but for your whole life, you need to take the medication. The strong thrombolytic agents. So you need to take this kind of medication for the rest of his life. Such, for example, if he lived 70 years old, he probably have the 50 years. He has to keep taking the medication. But for the young generation, their dialysis It's very fast. So for them, for the young generation, we really recommend it to perform the bowel repairments. Through the bowel repairments, the patient do not need to take the medications, and we perform the minimally invasive mitral valve repairments, and the effect is very good. And his parent is also very grateful about these surgeries. And for the coronary bypass surgery, we combine with cardiology. We can perform the graft, for the aortic stent graft placements. So after we did the bypass surgery, now the cardiologists, they can perform the stent graft placements because there are three main arteries in our heart, and we can fix two arteries, and the other artery we can place a stent to support it. So there's a hybrid operation versus the da Vinci surgeries. Actually, the incision is about the same. This is in the Stanford hospitals, and their incision wound is very similar to our wound. It's very comparable to the hospital in States. So in Dalin Hospital, we have the critical care units, and also this minimally invasive surgery centers with Chief Zheng Yin Zuo. And we also have another department as a peripheral vascular unit. So we are planning to apply to become a training hospital as a cardiac agents, cardiac departments. And we also planning to perform the heart transplants. And we really appreciate everybody, all the Tzu Chi patients, all the Tzu Chi brothers and sisters to support our teams. And we have lots of equipment, and we need to buy lots of expensive equipments, especially with these medical environments. It costs a lot of money to pay for this equipment. So we appreciate all departments and all volunteers' helps that can support us to become a place that can protect lives. Thank you, everyone. We really appreciate the doctor's help, doctor's sharings, with all this knowledge that if you ever heard about this. So after you heard about this sharings, if you agree with this, you're impressed with this, please give him a big hands. So somebody give the feedbacks, and she said, and there's a feedback talk about the Dalin Tzu Chi cardiac surgeons, and talk about the heart disease, the prevention and the treatment. I feel that's very helpful. And the feedback from Shanghai, Sister Hong Chihuan, you think that Tzu Chi Hospital, we are fully equipped. We have a very advanced equipment with a very talented doctors, and also their couples, and he and his wife. They're so impressive. They're amazing. And how do we? There's a feedback that asks, how do we protect our heart functions? Actually, if you work hard, then that's a way to train your heart. That's the way to protect your heart. So a lot of times, if the brother and sister ask me how to protect hearts, and actually exercise is the best way to protect hearts. Like when you're working at the recycles place, you doing the recycle job, this is also the way to exercise yourself. And also the vegetarian listens. As a vegetarians, it's also the way to protect our hearts. And when you eat outside, usually they're greasy, they're salty, and there's too much oil, too much sodiums. So by the time you're buying food from outside, you might want to drain it with hot water to reduce the oil and the salt. So during your daily life, and if you have the hypertension or high blood pressure or high cholesterol, and nowadays the medication can treat all of these problems. But people ask me if I suffer from high blood pressure, do I need to take medication for all my life? And I would like to tell you that actually you can change your lifestyles to improve your conditions. And there was a couple, he has hypertension, and the doctor tell him to take more rest and to exercise and to eat the low sodium food. And by the time he first entered the hospital, he suffered from a very high blood pressures. And nowadays, we can have before the people can live in the very fresh air environments and they eat the organic food. So actually, nowadays we can find a lot of dangerous factors that will danger your heart. So I recommend everyone that can they can control your food and do more exercise, and you can protect your hearts without the medications. It's not helping that you take in the health supplements. Lots of patients ask me, I bought this health supplements. Is that helpful for my heart disease? And I tell them it's not really. When I look at the package, it doesn't. And it's not really helpful, and it doesn't have the CNS improvements. So actually, I'm not sure what the effect is. So for nowadays, with this new technologies, a lot of things, a lot of food, a lot of medication that was certified by the governments. So you don't need to be afraid of taking medications and keep a good living habits that you can protect your hearts. And I would like to ask the doctors, and there was a feedback from in Dalin Dr. Zhang Jianhua. He's a master to do minimally invasive surgeons. He lead everybody to work together and to give the patient reborn their lives and to pass out the Dharma series. And everybody was so touching, and we really appreciate your feedback. And we also appreciate the message and also this feedback from the other persons. He treat patient and he also treat patient's heart. He's saving multiple lives. He's so talented and so kindness. And so very mercy, Dr. Zhang. And his speech gave us a lot of knowledge, and we really appreciate your sharing. And hopefully we will have another chance to listen to your sharings. Okay, next.
And the next, we're going to share about the positive feedback. And there are four positive feedback from China, Kunsan, Sister Guo Meijun. We meet our friends online to open our hearts. From Thailand, city volunteer Liu Shujing share about how they recruit translation and interpretation team very fast and allow the people around the world to be able to understand city from the sharing online. And